On this episode, we'll talk about eating fruit after surgery. We'll also talk about setting a weight goal and also talk about binge eating. Hello everyone, I'm Dr. Alvarez from Endobariatric.com and welcome to episode 69 of the AskDrA show. Thanks so much for submitting questions. These questions this week, really good, fantastic questions. I really like them. Thanks so much for being part of the show. And if you're new to the show, of course, you know how to submit your questions using the hashtag AskDrA, using social media, or through my Snapchat account. Let's get into the show.
Is it normal to have difficulties eating fruits?
All right, so is it normal to have difficulties eating fruits after surgery? The answer is no, but it depends at what stage. That is the question here. So if you're recently jumped from full liquids to soft food or soft food to regular food, at that phase, you may have some difficulty with certain fruits. Down the road, let's say 3 months, 6 months, 8 months down the road, do you have difficulties? Let your doctor know. Maybe there's something wrong, maybe there isn't. Maybe you just need an antacid to put the fire out and create a little bit more space or room in there. But the answer is no. Patients normally don't have trouble eating fruits after surgery, but it depends at what phase.
How do you know when you have reached goal, if you were never given a goal?
All right, how to set a goal weight. So go by BMI, body mass index. It's the easiest way to do this. Go to Google BMI calculator. It's the easiest way. Google BMI calculator. If you don't know which one to choose, we have one on our website at endobariatric.com. And you can type in your height and your current weight and it will give you a BMI, a body mass index. Aim to a BMI of 25, all right? So that would be, once you reach a BMI of 25, that would be your goal weight. If you get to a BMI of 25, you would be a normal weight range, all right? Remember that normal BMI should be between 19 and 25. After 25 to 30 or 29.9, you're overweight, and over 30, you're obese. Over 35, severe obesity. Over 40, morbid obesity. Over 50, super obesity. Over 60, super obesity. So, and I have the classification there on my website. You can use it there. But your goal is to be under 25. So reach 25 will get you to a normal BMI. That is your goal weight.
Do people still struggle with the desire to overeat after surgery?
All right, binge eating. All right, so it's a touchy subject here because binge eating is considered an eating disorder. And if it's an eating disorder, that means you need treatment for this eating disorder. That means you can be treated psychologically or with a psychiatrist, etc. So make sure you really do have binge eating, or you're not just thinking you have it, because it's very different. Now, after surgery, let's say you do have this eating disorder, you're getting treated by it, and let's say a patient with a binge eating disorder has a sleeve. What would happen? So what would happen is this patient, number one is, remember that the ghrelin goes away, the hormone that produces hunger. So patients are less hungry, number one. And let's say they decide to have this binge eating attack, all right? They want to sit down and just eat, all right, to a point that creates an uncomfortable sensation. Well, the thing is, that same sensation they used to be, they would feel by eating, let's say, a bag of potato chips and dip and etc. Well, now it's going to be reduced in portion to about a third. So the sleeve will be continue helping these people out. It's going to it's going to stop them. It's got that emergency brake without going overboard to eating the whole amount they used to eat when they didn't have the sleeve. But remember, binge eating is an eating disorder that needs treatment. So the sleeve works really good because it's got that brake always on, always on, always on that won't let you go overboard. But if you still eat a lot with the sleeve, you will create or reproduce this uncomfortable sensation that was reproduced, of course, even before surgery. So it's remember, I've said it again, I'll say it again today, sleeve is a tool, but if used wisely, it will give you enormous potential. So that's it for episode 69 of the Ask Dr. A show. Thank you so much. Question of the week is, did you have trouble with fruit? Yes, no, and at what phase? Answers below. I'm Dr. Alvarez from Endobariatric.com, where we are changing lives one sleeve at a time. We'll see you next week.